It's a common misconception that people who have autism lack empathy, and I'm going to tell you why this is incorrect. First of all, what is empathy? Empathy is the ability to understand and share the feelings of somebody else. It can also be described as being able to put oneself in somebody else's shoes. One can understand why people might believe that autistic people lack empathy. Consider an autistic child. They often find it hard to recognise emotions, recognise facial expressions and other emotional cues like tone of voice and body language. They find it hard to show and manage their own emotions, understand and respond to other people's emotions, or will respond in a different way to neurotypical children, and therefore one may assume that they lack empathy. However, it is not true that autistic people lack empathy. People with autism show empathy in different ways to neurotypical people, and neurotypical people may misinterpret autistic people's ways of expressing empathy. Moreover, many people with autism actually experience excessive empathy. They have sensory dysfunction, are highly tuned to the environment, and some autistic people walking into a room may be able to feel every person's emotion in the room. Now, there are two types of empathy, cognitive and affective or emotional empathy. Now, cognitive empathy is where an individual can see something from another person's point of view. This is also called theory of mind, and autistic people do lack this. Therefore, they are different to neurotypical in this respect. However, there is no difference between autistic people and non-autistic people with regards to affective or emotional empathy. This is where somebody has an emotional response to another person's mental state. Autistic people care about how others are thinking and feeling and are able to have warmth and compassion and concern and caring for other people. The autistic researcher Dr. Damien Milton described double empathy in 2012. He said that non-autistic people know how to communicate well with each other, and so do autistic people with autistic people. However, when autistic people and non-autistic people try to communicate with each other in ways that make sense and they can understand, there is difficulty. Now, I just want to mention alexithymia. This is where a person cannot identify emotions in themselves and have difficulties describing these or putting a name to them. And they also find it difficult to express emotions. And people with alexithymia lack empathy. Now, 50% of autistic people have alexithymia, but alexithymia is not specific to autism. There are also higher rates of alexithymia in people with eating disorders, depression, substance misuse, schizophrenia, and other psychiatric and neurological conditions. And also 10% of neurotypical people have alexithymia. Thank you for listening. Bye for now.